Hi, everyone. It's Angela Love Zarenka from Lactation Education Resources, welcoming everyone back to the Nikki and Nikki webinar series. Thank Nikki and Nikki for coming and for chatting about all things which are COVID. The topic for today is on hybrid support, how to help families both in person and virtually. So without further ado, I'm going to turn it over to Nikki and Nikki. Hi, everybody.
Hello.
Hello. Hi.
We're
We
back.
back. We back.
It's been a minute, but we're back. Hey, so
Yes.
thank you for joining us again. I am Nikisha Killings, private practice lactation consultants coming to you from Florida now, and community lactivist and director of equity and inclusion with LER, as well as one half of Nikki and Nikki Lactation Career Consultants.
Hey everyone. I'm Nikki Greenaway, also known as Nurse Nikki. I am the other half of Nikki and Nikki. I am a family nurse practitioner specializing in women's health. I'm an IBCLC in New Orleans, Louisiana. I have not moved. I'm still here. um, and I have a private practice and called Bloom Maternal Health, and I'm one of the co-founders of the New Orleans Breastfeeding Center, a freestanding breastfeeding clinic here in New Orleans. So we thank you for coming back and joining us.
Thank you. Today's topic is going to be about hybrid support, so helping families both in home and virtually, and sometimes in office again. But before we delve into our topic, we wanted to make sure that we honor the place where we are, both as a nation and globally. The collective trauma that we're experiencing and the very real lives that have ended even since uh, our last call. So in order to honor that and honor all that is happening right now, we're going to take a little time of silence and reflection at the beginning of this call. We appreciate your patience, and we'll be back in 8:46. Thank you, everyone. We appreciate that. Your
Thank you.
patience as we took a moment to just be silent and reflect on what's happened in our nation since we last spoke. So, as we always do, we'll start with a little bit of a check in. We'd love to hear, audience, how you are doing right now. Nikki, how are you?
I think every time that I do the moment of silence, that the 8 minutes and 46 seconds, it's a lot of emotions, and you could just feel stuff kind of just inside. Um, but as far as my space, in New Orleans, we are, in terms of COVID, we are in phase 2. We are moving, I think, slower than any other city. And that is rightfully so because we had some very high cases. I checked the numbers today, and we did have a spike this weekend of 1,300 new cases this weekend, and we had 55 deaths. So, as we knew it would happen, and then in the midst of, we've had folks protesting, we've had constant protests um, daily, and people getting out and living their best lives in the midst of all this. So we knew we would have a spike. So I've been I've returned to home visits, and 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 there's a hierarchy of home visits as far as, and I'll talk more about that in a little bit of how I've decided who gets a home visit. And then but yeah, but we're good over here. We're still in our bubble.
Okay, good. Um, yeah, since I last saw you all, I've moved across the whole nation,
Whole country,
the
whole country.
whole country. And now I am, sorry, I'm gonna enlarge here. All right, so I can see you better, Nikki. Um, I am now in Florida, and Florida is a whole different beast than California was in terms of COVID.
Mhm.
So we're talking about moving from a state that was under, lockdown for real, like safer at home, everybody gets it. When you see people out, they have on masks or they are essential workers or they're out because they have to be. To go into a state now where everybody's out and doing business as usual. And
Mhm.
the governor's been very, very clear about we are not shutting back down. We are opening back up. We're on our way to being opened back up, in spite of record cases every single day of the last several
Mhm.
days. Each day we outdo the last in terms of new cases. My tiny county doesn't have very many cases going on. What I found is that when we get to places outside of the hot spots, it's like you don't see it, so you don't believe it. I think is the
Mhm.
sentiment. So folks just really don't think it's a thing. Like we came here as an oddball family wearing masks, and people would come into our home like, "Why do you have masks on?" And we would say, first, in order for you to come in, you have to have a mask on. Worker, a mover, whatever person was coming in the moment. Um, and then secondly, because we came from a place that's just taking this a whole lot more seriously, and we don't want to we didn't want to bring anything with us to this community,
No
but we
souvenirs.
also not
No
bring any
souvenirs.
souvenirs, but we also didn't want to acquire anything once we got here. So we're
Got it.
continuing to stay the course and be really, really vigilant about hand washing and sanitizing and mask wearing, even if we are the oddballs. And unfortunately, I think the state will catch up
Mm.
in what will be known as the second, third wave. I heard a practitioner say today there's not. This isn't a second wave. It's still the first wave that
Still the
nobody
first
took
one.
seriously,
Exactly.
or not enough people took seriously. So I think that we're on the cusp of probably a really, really tough cold and flu season
Yeah, I
from time.
agree. I agree. Um,
Um,
Thank y'all for coming back
yeah,
today, and we hope to, as we talk about different spaces opening back up, and you're trying to figure out, okay, I've been doing this virtual thing for 3 months. I went into this not knowing what I was doing, got it rolling. Now you're telling me I can go back into the home, and we're not telling you, we're saying that you can do both. You can do both virtual and in person visits. And we call it in person because we do realize that some of you are doing in person, whether it be in an office space, or some of you are doing in person, whether it be a home space. And I want to take you back to, I guess it was like what, our first or second uh, webinar, that we talked about an algorithm and a flow chart, and how do you figure out, you know, should you do virtual, should you do a home visit? And so we want you to go back to this algorithm, and it's on lactationtraining.com/COVID
We'll
hyphen
drop it in the
19.
chat
And
as
you'll,
well, sir. So we'll make
yep.
sure we include it here as
And
well.
we want you to look at this to make that determination. And if you look at the top of it, and we're still going to say this because I don't care what phase we're in, we're still going to say this, and which we should have been doing anyway, like even during cold and flu season: screen, screen, and screen. Please
Yeah.
screen your clients. Just because they just came from home from the hospital and you're like, oh, they're clean, you know, that no, no. There could be somebody in the home that is exhibiting symptoms that was not able to go to the hospital, because in a lot of spaces it's just that, you know, one person, or they can't have visitors, or whatever the situation. So please continue to screen, and don't, you know, like screen them at the door when you get there and you're like, have you been in contact with anyone, you know, that had COVID symptoms? This is something that we do ahead of time. So we can't stress that enough, that you still need to be screening, because COVID is hiding in plain sight. Okay. And it is there even if you cannot see it, even if you have not personally experienced it, whether with yourself or with a loved one. It is there, just like the flu is there, and all of those things. So please continue to screen your clients. Use the screening tool that's on there. It's been very helpful, and we pulled all of that information straight from the CDC. So, you know, it's not something that we made up. We want to pull it from evidence-based resources. Um, Always. So ask the COVID questions. You have anything on that, Nikisha?
No, I was asking, Angela, if you can go ahead and share that, if you can find it, a direct link to that, that would be helpful. Oh, actually, I do. Um, so some of us are in the place, and I think there's probably, this will be a fluid type of situation for the next year
Mm-hmm.
or more, deciding whether or not we, feel comfortable going in home. And depending on what the pandemic looks like in your area, you make the decision that makes sense for you. But we want to help you.
Absolutely.
Guide you in making those decisions and help to affirm whatever decision you make by helping you to have the tools to be safe and be effective in whatever type of visit that you do, whether you have a practice, you go into homes, or you want to try virtually. So Nikki,
Right.
what are the
So
oh, sorry, go ahead.
oh, I was about to go into the prep. Is that what you were
Yeah,
going to ask me?
yes, I knew you would.
So the next part, just with screen, 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 is prep, prep, prep. So I find that there are three different ways that you can prep. There are three different steps to your prepping. Number one, you need to prep your practice. And that means to intake and clients before the visit. And you may not have done this before. Some folks, you know, they like to do it when they get there. And we like to think of, if you're doing an in-person visit, I like to think of it the same way as a virtual visit, because you have a finite amount of time, right?
Mhm.
And you want to use your time wisely. Also, you want to get outside of their microbes as quickly as possible. Because remember, you're going into someone else's bubble. And we're all in our little bubble. So you're going into somebody else's bubble, somebody else's germs. And you don't necessarily want to be there a long time. You know, like, oh, my visit 2 hours. Do you really want to be there 2 hours? So I think all of anything that we can do outside of the visit time, like the actual in person, helping this person, guiding this person, then we need to do it. So intake, all of those things, get your payment, your intake, and your consent form already out the way before you actually show up. It's good to have it, at least, in time for you to look at it. Please look at your intake forms before you go. Because if you don't look at your intake forms, then you're doing an in-person intake.
Mm.
So please look at all those things and get that stuff out of your way. So that's how you prep. I call it prepping your practice, right? So the next part is, oh, go ahead, Nikki. Sorry.
No, 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 no. I'm listening. You're good.
The next
Continue.
part is prepping your client. Okay. So you want to prep your client. And what that means is telling them how the precautions that you're taking, like cleaning your materials, how you're going to be prepped, how you're going to be wearing a mask. Hopefully everyone has decided that they're wearing a mask. and prepping your client and saying, do you want them to wear a mask? In my practice, the way that I do it, you have to wear a mask, or I will give you one to wear. And then when I leave, then I put it in my little dirty bag. But and I say that because I also work with some individuals that may not have the privilege of owning a mask. So homeless women, so they may not have a mask. So we make sure that they are wearing one. So you having a mask, telling them, hey, I'm going to clean. I use Lysol wipes, or I've cleaned all of my materials using this. We're going to use your blanket on the scale, or you use a disposable paper or whatever. Prep your client to tell them exactly what to expect from the visit and which precautions that you're taking. And then the last prep is prepping yourself. So all those things you told your client, you actually need to be doing those. Like, your dirty clothes. Like when you go into their space, how many visits are you going to see that day? and what are you going to do about your clothes? So let's say you have a 3-month-old and a 2-day-old. We probably want to see that 2-day-old first, and then see the 3-month-old, because you're technically going from clean to dirty, or less dirty to dirtier, if that makes sense. So if you have any questions about that, please drop them in the chat or in the questions. Nikki, do you have anything to add to that?
No, I want to real quick take a pause, because I think that's excellent, excellent advice for sure, for if we're going to see the client in person. If we're going to, how does that differ if we're not going to see them in person? What do we do? How do things look differently um, in both determining to see them virtually, like, no, not going to be able to come to your home,
Right, right,
and setting up and prepping before that call? How does that look different?
right. So what I've been doing is how to decide whether I'm going to see a person in person is how old is the baby.
Mhm.
And that to me is my determination. Like if your baby is less than a month, then I'll come see you in person. But if your baby's more than a month old, then I don't. And that's something that I've established for myself, and in seeing my clients. And then with my clients, I actually have a distinction with the homeless shelter. If they're less than 3 months, then I go and see them then. Because I know that maybe their next visit may not be until their postpartum visit. And so I may be the only person that they're seeing. So that's kind of the way that I distinguish it. There's no rhyme or reason as to that's kind of what works for me, and what I've seen is what problems. But virtual, again, even if you see a client in person, you can follow up with virtual. So I know a lot of people do follow-ups where they go back to the home. You might want to think about, okay, my follow-up is then my virtual visits. Our virtual visits have been working. We've been helping people, and some people find they're like, oh, I rock at virtual. This is awesome. I'm amazing. And other people are like, no, I want to do my in-home visits. So how can you make your in-home visits safer and healthier? But also, how can you make your virtual visits work for you when you're operating in an in-home space?
Yeah, I appreciate that. So being able to have a touch point in person, but then continue to follow up with them without having to expose either of you to the other
Right.
person's germs after that. I actually would take a different approach in my practice, because I'm not a nurse practitioner who sees the whole dyad. I mostly focus on breastfeeding as the issue, and all that has to do with breastfeeding. And I don't necessarily look at the mom
Yes.
from head to toe as Nikki does. So I wouldn't be trying to provide postpartum support to mom in the way that Nikki does. So I tend to feel more comfortable seeing babies that are a little bit older, who have established a little bit more of an immune system, who have a little bit more protection. Um, in the event that I'm introducing anything into their environment that is not good. So that's a really interesting delineation. And you, of course, practitioner, get to choose what makes the most sense for your practice and what you have to offer.
Absolutely. Absolutely. I think for me, it's just a lot of those issues, and I know how quickly families are leaving the hospital. So my thing is, like, I'm trying to get on them as quickly as possible to get in there. And I would say those visits aren't as long as they used to be. Like the
Mhm.
earlier I can see them, those visits are super short, because it's quick latch, adjustment and things like that. The visits do look a little different when I'm in there. I find myself, I holding my hands, and stepping back. I wear apron when I go in. I will tell you, when I put on my apron with my first client, And they were like, I'm sorry, what's about to happen?
You here to cook something? What's happening? Yeah.
Did you bring food? Did you bring a meal? So I put on my apron, and I think they quickly realized, oh, she's, like, um, one person like, oh, like the granny midwives. I'm like, yeah, yeah, kind of,
Oh,
kind of. But I have like these flower aprons and they have pockets, and that's where I kind of put my hand in my pocket. But they're all clean, and I'm bringing them out with each new visit. But I would say instead of the 6 feet, I'm a 3 feet, 3 feet person. So I stand about 3 feet. That's where my vision. That's where I can see well, and then I step in to adjust, and then I stand back. One thing I did, I have not brought a doll. I did not. I know we talked about that earlier with the return demonstration. That is just a whole lot of stuff. I have decreased the amount of stuff that I bring into people's homes. Also, I bring like a little caddy, kind of like a shower caddy thing, where I can see everything and I can pull it out, as opposed to in a bag, nooks and crannies, and all that kind of stuff. So I have this little shower caddy with a thing of Lysol, my blood pressure cuff, my stethoscope, and those type of things, and I'm carrying that as I go in. And everything is virtual, like you get your care plan virtual. Like there's no shuffling of papers or anything like that. So I've tried to streamline that, but mind you, it does put a lot back on you, to get that intake information. Make sure you read it, documentation as you leave. You're kind of, so it does put, trying to be COVID clean, as I call it, trying to be COVID clean, does put a lot of responsibility on you, and a lot of legwork and stuff like that. So
it
I'm interested
does.
to
It
hear
does.
how some folks are doing it.
Yeah, and I have a sense that some of the folks listening will just say, you know what, I'm just not comfortable with this, where I live or what's happening in my city or how the families here role. This is just not a comfortable thing for me. I'm going to stick to virtual. And that's absolutely fine. Provide the
Oh
support that
yeah,
makes sense where you are and that you are most comfortable providing. But someday you will be dipping your toe back in the waters of seeing families in person. And so we hope that you'll take some of
hmm,
these great guidelines into account when you do, when the time is right. And that could be next
right,
year or even further out for you.
right, absolutely, absolutely.
So what's next, Nikki?
And so once we just keep in mind that, like I was saying earlier, and we've talked about this before, it's always good to have an arsenal of things, because your visits may be a little bit shorter. Know that you're going to have some more, your follow up maybe sooner, or you may have to teach or send other forms of education. So I like to have, and I've talked about this before, a little album on my phone of evidence based, like pictures and videos and things like that. I think it was Brenna, I think, who said she has like a spreadsheet, and that she's been using that. She actually does, like, on her virtual, she does like a slide presentation almost, and like she brings up like whatever their thing is, she taps it on her spreadsheet and it pops up on the screen, and she shares her screen with them. And I was like, oh, that was genius.
That is really smart.
um,
Okay.
Right. And showing the video while they're on there, things like that. So having your little arsenal of things that, resources that you can use in the home, where you can send them stuff like, I'm actually just going to text you a video of this, just to reiterate what I'm talking about. And that can be a part of their care plan. Remember, the care plan doesn't actually have to be in paper form. And know that families are receiving tons and tons of papers from the hospital and everywhere that they go. So who's sending them really like a video? Like it could be a video of you, like talking through the care plan. And they can play that video, like, okay, what did she say again? And play the video. Or like a little slide, like 3
Hold on,
slides,
hold on,
and
hold
they
on,
go through
hold on,
pictures.
hold
What?
on.
What?
I think you just hit on some genius here. Hold on. I need to just pause that for a second. I think that's brilliant. I don't know what you all think listening out there, but I feel like if I could just create a video walking them through their care plan, they would listen or watch that before they find the paper and read it and pull it up on their phone.
Right.
They would just play that
Right.
fast. What did she say about weights and how much? Fast forward to that section, play that, and be done. And they got me there.
Right.
No misinterpretation. I'm saying it with my word, the way that,
Mm-mm.
what?
Right. And then you
Adding
get
it,
all of
doing that.
this, like all of this finger movement and everything, in your video. You get
Yes.
it. I'm still there with you.
I love that.
So yeah, so I've done that like once just because a mother, she was blind, right? And so we did a lot of she was legally blind, she could see some things, but if she was just hearing me say it over and
Mhm.
over again was much easier for her with that. So I was like, we have to use all of the senses, right? Like I think gone are the days of this paper stuff. Like if
Yeah,
they did discharge instructions at the hospital and they just put it up on the TV screen, I bet you more people would listen. So we have to think outside the box, and COVID is making us do that.
I think that's a fantastic idea. Thank you for sharing that gem with us. For sure.
No problem.
This is why she makes the big bucks, ladies and gents. This is why.
Multi-dollar corporation,
Hmm.
multi-dollar. Yes,
And everyone and individuals as well. All right. So
right,
that's fantastic. So we've gone, we've met, we've been careful, we've carried very little with us, we've sanitized
right,
all the things going in, we've covered ourselves. You go out of the home, you bid them adieu. Now you've
right.
got your dirty things. How do you do the disrobing once you get home? So this is going back to kind of our in-person consults that we had a Q&A on a
Yeah.
while back.
Um. So disrobing has been a thing. It's interesting because I come home and I come through my backyard, and I was taking my clothes off outside, but I have some lurkers
Mm,
who I found college students over there saying woohoo. So now I just step
okay.
right into my house, and there's a trash bag there waiting for me to take off my clothes and put in there. My family's always prepared for when I come home because the door is locked to my room. I can go take a shower, and then I take the trash bag down the hall and I dump it all in the washing machine. So that's what happens here. Now, before I do all that, before I get out of my car, I do take the Lysol wipes. I wipe down all of my equipment and I wipe down my seats because I have leather seats, and then I just throw that in the trash can on my way to the back door. So that's kind of how I do it. Just as to put it in perspective for you, the way in which they're telling the daycare teachers here to do, and it can relate to some of the things that you do, is that they wear a big shirt or they wear a scrub jacket. And once they finish seeing the kids, they take that scrub jacket off, they put it in a bag, and then they get in their car with the same clothes that they had on from earlier. So if that's something that you want to do, just having on an extra article and taking that off, so you don't have to totally derobe. But it's always a
Makes
good idea
sense.
when you come from someone else's space to take your clothes off before touching your loved ones.
Yeah, yeah. That is a good rule of thumb, even outside of COVID. But we know that
Yeah.
everything has changed, and a lot of it has changed for the
Hmm.
permanent. So we'll be talking years from now. We'll be talking about pre-COVID and post-COVID. Those eras,
Right.
and there will be starting in the era of COVID, everything changed, and we went to this place
Hmm.
where a lot of the stuff that we normally did in person has moved to virtual. So, um, even if you've seen the family in person, we now know from this conversation that follow up doesn't have to occur in person as it did before. Follow up can be a virtual thing, a conversation with the parent. For me, it always is an ongoing conversation anyway. It's not just
Hmm.
I'll talk to you again in 3 days and 7 days. It's you have open access to me in my practice,
Right.
from the time that I see you for some window of time, right? A couple weeks out. So a couple months, depending on what the severity of the issue was or complexity of the issue. So they have access. They can continue to reach out to me. And now we are much more, um, adept at Zoom and video calls, and we can take, the next touch point you have with them doesn't since we're trying not to do in person, or if you don't want to do in person, you're limiting that. The next touch point doesn't have to just be a phone call or text. It can now be a video chat, and you can incorporate
Right.
all the different ways that you interact with
Hmm.
families throughout the various parts phases of a consult of the journey with the
Right.
family.
And the best part of that is that you've already done like your oral assessment and all those things. So you don't have to worry about you're like, oh, I can't do oral assessment. Oh, how's that like we're just it's just a review. That's it.
Yes. Yes. You've seen what you try to see all that you need to see on that visit to make it your last visit. If
Hmm.
if this is an
Yes.
area that you don't want to, go fully back into, I think that's a great point. Yeah.
Hmm.
So even if their ties wasn't a thought, even if, there wasn't a concern about palate, you get a look at all that while you're there. So that when you refer back to this later to the client later, then you can have an opportunity to just kind of go off what you already saw instead of needing to see them again. Yeah, that's great advice. All right. Anything else we're
Right.
missing, Nikki?
Um, let's see. I think some folks were already doing this. Like this is
Yeah.
nothing new to them.
Yeah.
So hopefully this will provide some encouragement for the folks who are like, I don't know how to do both of these. I want to do both of these. So hopefully, but please refer to the handouts that we have online because I think they are very rich in information. And they'll really help you establish your virtual presence, but also get you back into doing your home visits in a safe and healthy way. So please just like I think you should just like print it out, create like a little binder, and flip through them as you need them or your Google Drive,
So
and
these,
do stuff
sorry.
that way.
No, I agree. Yeah. These resources are all at lactationtraining.com/COVID-19. That is where you can find not only all the previous Q&As that we've done and all the various topics, except for one that didn't get recorded that we'll do over for you someday. Um, but you can find all the previous Q&As and you can find these fact sheets. One of them is the algorithm on how do I make this decision of whether or not to go into a home. That is, still current, still really relevant today. From the beginning of the pandemic till now, it's still a really, really good sheet. And that's what we're referring to. And then we talk through the anatomy of a consult, everything you should do in an in-person. What does virtual look like? Everything you should do in a virtual consult. We've got all those things in fact sheets on that particular page, and some are even, I think, going to be translated, if not yet, have already been translated into Spanish. So don't miss the opportunity. It's in the chat. The link is there to go to that as a resource site to get all the information that you need to be a wonderful, wonderful help to your community. Any
Yeah.
questions, thoughts, feedback from the audience? We are here. If you want to
I also
type
wanted to
something.
add that with the screening tool, you want to make sure that you're screening yourself as well.
What does that
So
mean, Nikki?
we have to now be cognizant of our contacts ourselves. So, for example, there may be a block party coming up,
Hmm.
or you may like, let's say you're going certain places. You have to be cognizant of where you're going and your exposure because now you're going around small babies if you choose to do in-person visits. So now I have to say, like, for example, there's someone's having a small party on Friday at their house, and I have to think about, now if I go to this party and someone at this party has been exposed, I'm sure they're not screening and taking temperatures at the door. Now, mind you, they said it's only going to be 10 people, but still, I have to think about, I have a responsibility to my patients to be clean myself when I go into their space. So it may limit you from your social interactions because I know everybody's on a different social scale than what's happening here in New Orleans. But here, I'm still very cautious about people that I'm around. I still, people come visit my house. They're on the sidewalk and I'm on my porch, which is at least 8 feet away. Um, so, if you're deciding to go back into the home, think about social events that you probably can't be a part of because you've made the decision now to be in someone else's space. So whatever you bring with you, goes into someone else's space as well.
I think that's fantastic insight. I would also really recommend that each of us who is in this work stays on top of whatever the latest science says. That's a part of
Right.
protecting ourselves and our community. So we've seen some kind of conflicting stuff about it being present in breast milk and to what level and if it's active
Hmm.
virus. Stay on top, read, dig in as much as you can, continue to stay abreast of whatever the latest science says because that too impacts you and your practice and your communities. We need to know if, oh my goodness, they just realized that, whatever, um, that it's transmitted in this way we didn't know, or this particular factor can really be important in terms of when you engage with folks. If
Mhm.
3 feet is okay, was six and now it's three, whatever, that should inform the way you go about doing your work and the way you're engaging with your community. So we hope that you will um, stay thirsty, stay curious for knowledge about this, and as more and more and more comes out.
Yeah. Cool.
That's it.
Angela, do we have any questions?
Hi, yes, I do. One person is asking, just one second. So one person is asking about pricing. So do you charge for the access
Mm.
to you after the initial visit, or is it extra, or is it included in the original amount? And has that changed pre and post COVID?
That's a great question.
No,
You're
I do not charge extra. I am what you call the broke philanthropist.
oh gosh.
I just give stuff away. But no, I don't. I don't charge extra. It's reflected in my price. My pricing probably should be more than what it is, and we also have to think about market. So what I charge here is different from what they charge in LA full shore, and probably what they charge in Mayville, Florida. So, but it's different pricing. It depends on your area, and also I've put that on myself because I'm just want to know, and I don't want to charge them extra to. I just saw them like last week. I want to follow up, and that's just a part of my process. I'm actually bound by law as a nurse practitioner to, if I do these services, I have to follow up. That is a part of the process, so I'm not going to charge for that.
Yeah, I haven't charged for follow-ups in the past. It was incorporated into my initial visit fee. And but it was finite. It was, you get access to me for 2 weeks. And then you may have to, pay for a follow-up visit if more is needed beyond that. To your point, I think this is a great time to reassess, because I've already,
Hmm.
established that maybe follow-up is a little bit less finite. Maybe we don't know, how long we need to keep in touch with the family, either virtually or, through text, email, what have you, phone calls. So I think I um, would be open to creating a little bit of a scale that has to do with, if you still need me, if you want to touch base, have a video chat, a month or two after we initially met. This seems like it's a new issue, or it could be a continuation of the first, or a re-flare up. Then this is what that pricing looks like, and it would be reduced from my normal, um, you know,
Right.
visit, but certainly not free. So I think
Right.
that's a great point.
And when I think about follow up is text messaging. If you need
Yeah,
another visit, then obviously it's a fee, but it's probably be virtually, which would be a decrease.
less than in person. Yeah, that's
Yeah.
how I do mine. Any other questions?
Well, I just have a question though.
Yeah.
Though to that point, I mean, do you ever get to the point where there's just too much texting? I mean, I know that you can text if you're like, moving, and dealing with your family and everything else, or on with another
Hmm.
activity. But what if texting does get to be too much? What's your line, and how are you able to store that in your electronic medical record?
Ooh. Yeah.
Good one, Angela.
Yeah. Uh,
Um, how do I do it? I think if it takes more than 15 minutes, I kind of just if it's like really like, you know what, I can show you better, I can tell you. That's when I get to that point in the text message, like I can show you better, I can tell you. I'm like, you know what? Actually, I need to come back over. Or let's do a video chat. I think you qualify, like this would be good for you, a follow up visit. Then I recommend that. And they're like, oh, no, it's okay. I'm like, okay, well, we're not texting anymore. But the way that I do it is I have just a quick note in my EMR that you can put in there underneath the person. You can just type in a quick note, or you can do a telephone um, note in there where you talk to them on the telephone. So I just make sure to capture all of those things under their chart.
yeah. So for me, it's oftentimes the families that are reaching out afterward are very, apologetic and just, I'm so sorry, but can you tell me this, so they're not
Hmm.
abusing the access to me. I haven't seen that very
Right.
often. In the times that I have, I will say, you know what, this necessitates another visit, or I need to see you on a video chat. Excuse me. And for that, I would have to charge if it's a whole nother consult. It depends on,
Hmm.
usually it doesn't require that much more, and it's just a few minutes of my time, and I'll give that a few minutes. But if we're talking about full on, reassessing something, then I have to charge again for that. I actually screenshot and print text messages and file them hard copy. I don't have any other fancy way. That's just how I capture. I have my text set to save for up to a year on my phone, and then whenever I get the opportunity, just that puts them. I screenshot so they get on my cloud, which is also saved forever and ever, and then print them down when I'm ready.
Well, and someone else is chiming in on that one, that they actually just make a summary of the notes as if they are as like a telephone consultation. They make a summary of the notes and
Hmm.
just literally pop it into the patient's chart, or just some EMRs allow you to just have for a phone consult or a phone log of some sort. So
Yeah.
whenever they're in their charts, I mean, it is one extra step, but it is something that it's important to log. So that's good.
Hmm.
Okay,
Sure.
so another question is, are you sharing with your clients in written form about the COVID precaution choices you're making outside of work, like in your daily and family life? And then second question, easier question, where are you getting your masks? So one thing about the
Mm.
first question and answer the second one.
Oh yeah, answer the second one first. Um, I get so I have an N95. I wear N95 for all client visits. Just because while they said that they may not have been exposed, I just can't take that chance.
Mhm.
So I do wear N95. It is uncomfortable as hell. Like it is not comfortable at all. And one thing about the N95 is I can't wear my glasses with it either. Because my glasses totally fog up, and I tried doing that, and I just couldn't. And I don't wear contacts, so I'm just gonna be partially blind for the visit. But I do wear N95, and I tend to wear a cover over it, like a mask, a cover over it, just because it's a white mask, and I just want I only have one. But that was ordered through. That was actually gifted to me from I don't know, a stranger. They left it on my porch. They were doing that for healthcare workers in the area, and they found out about my practice on Facebook. So that's where I get mine. But you have to decide if you're going to wear N95 or if you're just going to wear a face covering. Now, mind you, the face covering doesn't protect you from particulates, but it does create some form of barrier between you and the client. As to your first question, I have not posted explicitly that I am being a hermit for the sake of my patients. um, if they see the lack thereof from my post, they'll probably come to like she ain't been nowhere. Um, but I haven't. But I also been very cautious about, like we went to the beach the other day, but then we were in our own bubble in the beach at the beach, like we didn't talk to anybody or anything like that. So I'm just being very cautious about the things that we do post, but I haven't been anywhere. But that's a good point. And how far is it all depends on how far you want to take this conversation with your patients. Is it their business? And they're going to take you on your word just like you taking them on their word. Like
Yeah.
you say you didn't do anything for Memorial Day, but then you were at a party with 80 people. So we have to have that level of trust. So I'm so big on just gonna have to trust it.
Yeah, no, I haven't published anything either. I am forthright though. I let them know, hey, this is what we've been doing. I haven't been anywhere in 4 months.
Mm-hmm.
Now I have to add in, but I did fly across country on a major airline. But we quarantined for 14 days, whatever. I share with them where I've
Mm-hmm.
been, what I've been doing as a family to keep them safe. For as far as masks, um, so two things. My husband's military. He was deployed to a place that's very, very, very polluted, and so he stocked up on what's called N99 masks, and so I have some of those that he got for that purpose because he had to wear coverings all the time because the air quality was really, really poor. So we just, that was serendipitous that we had those when this thing began. And however, my daughter is child seamstress, also sews the cloth mask with the pocket. In the pocket, I put a layer of melt blown fabric that can just be purchased online. And melt blown is the same material that the N95s are, those surgical masks are made from. So I put a layer of that inside the pocket to give me one more barrier. And that's kind of my process. I tend to wear the homemade cloth mask with the melt blown inside the pocket more than the N99. It's less comfortable. And that's that on that. I wish I had a reference for you. Oh, just go buy them here. I'm sorry that that's not ours came by.
Yeah, and I think that's hard. It's hard for anyone to say like where exactly, they're getting their supplies from, because it's some places it's still hit or miss, or where even small practices like my medical practice, like I'm trying to figure out where to get Clorox wipes, like things like
Yep,
that, because
same,
they're in shortage.
same. Even in places that aren't taking it serious, you cannot find sanitizing wipes. Blows my mind. Cannot find them here. Any other questions,
Hmm.
Angela?
No, I just wanted though to just take a moment to share the screen as far as, let's see, can you see my screen here? Let's see. Yep, there we go. So y'all were referring to those handouts earlier. And so I just want to show
Hmm.
you that here is the phone triage algorithm for determining a home visit or a telehealth visit, teleconsult. We also have one for, this is great suggestions for the products that you want to take, the things you want to do, how to be ready for it, both before and after. And,
Yeah.
thank you to your credit, Nikki, you did include some things in here, you foresaw how you would need to start to go back in. And so what are some of those things that you can have and have available?
Hmm.
And then also here's this one about PPE. So what sort of PPE do you need if you're going into people's homes? And it really has to do, and it even shows you how to take on and take off gloves, because what is that? What does that look like? And so I think this is really helpful for both, anybody who's any sort of community health worker.
Anybody? I love
Yeah.
these free resources from LER. Thank you, thank you, thank you for sharing those,
Hmm.
Angela.
And we
I
are
hope,
Yeah.
translating, yeah, we've translated the first three into Spanish.
there we
And
go.
so we're working on the rest of them. So indeed, we do have the translations going. If anybody would like to offer other translations, we're down with that. Please, by all means, anything that you have that you want to share, please do. To your point on masks, I do know of a few people who've been able to, the medical masks. I know some people who've been able to down, or they just sort of like keep popping on some of the online sites, and then all of a sudden they'll see it and they'll order them, even though they're not going to be arriving for a month, but they'll order them.
Yeah,
One lactation consultant I know said that there were Chinese writing on her on the masks that she received, and it took weeks to get here, but she just ordered 20 just because she's just trying to get a bunch of them. And someone else said
Hmm.
that they found them, her allergy, that where she orders her allergy supplies for her kids, that the allergy workshop, or I think it's called Allergy Warehouse or something like that, they had them, or every now and again they'll have them. And so she'll just pop on there and just order them. And whenever they arrive, but at least, you've got something coming in the pipeline. So,
Right.
yep. That's a great idea. It is.
Good idea.
yeah.
All
Anything
right.
else that y'all
That's
have?
that's it. That's it for us today. Unless you have any other questions, I did want to shout out my shirt uh, from a phenomenal young lactation consultant, Shelly Andrews in New Jersey, with Hey Mama Lactation. I got this shirt from her, International Board Certified Titty Tech. So I love this, my newest fun shirt. Just want to give her a shout out for that since I wore it today.
Thank you very much. And so when are y'all going to be doing this again?
Good question.
Ooh. Yeah.
Ish.
So
Ish.
we were seeing you every week during the heights, the early days of the pandemic. We are now going to try to see you every couple weeks. So I think July
Mhm.
1st is the next time that you'll see us. And we are always fielding topic requests from you all. So please let us know if you come up with if you have an idea, if there's something you really want us to discuss related to COVID. We are happy to do so on the 1st of July. Otherwise, stand by for a topic coming soon.
Excellent. That's wonderful. Well, thank you all so much for keeping this space for us and continuing to provide this support. It's something which is really so needed and so necessary, and this is so unique. And so, for people who are listening in today, I mean, I think you can all. I have attended a ton of webinars, and I'm just really grateful that Nikki and Nikki are still holding open this space to be real and to really talk to us about these things, because these are issues which are in front of us every single day, and we're wrestling with these things and we're questioning these things. And so thank you both for taking the time out of your very full lives to be able to share your wisdom, your kindness, your humor, because we need this. We just need this right now. And more than one person has come to us to say that this is the best part of their week, and so I know it shall continue to be so. So thank you both very much for taking the time and sharing your yourselves with us.
Thank you all for
Thank
listening and
you for
showing up.
having us.
As long as you show up, we'll be here.
Yeah.
Excellent.
All right, be well, take care of yourselves, everybody. Till next time.
Bye. Be well.